Now, as a busy mom, as an executive mom, when you navigate the whirlwind of daily responsibilities between your work schedule and your family life, it is not uncommon for you to experience neck pain or a nagging discomfort or stiffness in your neck. You may have at some or the other time heard other people mention this or experienced neck cracking for yourself. If you have been cracking your neck, you may have wondered if it is actually a safe practice. So, in today's video, let's talk about what exactly happens when you crack your neck, and what are some of the pros and cons of neck cracking. So, before we get into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is, back and neck, and nerve pain. And I do this by giving you simple exercises, easy lifestyle modifications, some tips, tricks, and hacks that have helped me in my own spinal and joint pain journey and nerve pain journey, of course. And I do all of this without taking away a big chunk of your time because, hey, we're months, we're busy people, right? All right, so let's get into the topic for today. Is neck cracking safe and what busy moms need to know? So, the very first thing is what happens when you crack your neck. So, there is, of course, a loud sound, which can be, well, it can either be scary or it can be very satisfactory, depending on which end of the spectrum you are on. And it is usually painless, but not in every case. It depends on how far gone your neck pain is. Is it just a simple neck pain, or do you actually have some neck pathology or problem going on? So, what exactly happens when you crack your neck is there is a covering on the joint known as a joint capsule. And in that, there is a fluid that is normally present in the joint capsule. However, when you stretch the capsule, that is, suppose, I'm not going to crack my neck because I don't do that. But if I was to say crack my knuckle here, so if you look at my knuckle here, this is on an extreme range here. So the capsule over my joint at this knuckle here is completely stretched. When you stretch it like this and you take it beyond the joint, and you heard, I don't know if you heard that click, but when you take it beyond that stretch, the full range of motion of the joint, the fluid inside, the liquid inside the joint capsule converts into gas, and there is a popping of that gas, which is also known as cavitation in medical language. And that is the reason you get that cracking sound. Now, if you look in your neck, you have the spine in the center, and of course, in the spine, you have your vertebrae that are stacked one on top of the other. So they're like bony blocks that are stacked on top of the other with the disc in between. So these bony vertebrae have got joints on the side between every two vertebrae, so basically at every level in your neck. And these joints are known as facet joints. So you have left side and right sided facet joints. So every time you crack your neck, depending on what level you're cracking it at, that facet joint is the one that pops, right? So, I mean, it makes a popping sound, not pops. So, that is the reason why. That is the basic principle behind how and why your neck cracking produces that popping sound. Now, interestingly, that popping sound can be quite satisfactory to people. Well, it can be scary to others, but when you're doing it yourself and you're in the habit of cracking your neck, it can be quite satisfactory. Now, it has been said that there is a release of endorphins. Endorphins are your happy hormones, the same hormones that are released when you exercise or walk, when you're out with your friends, when you're having a good time, basically. That those are the endorphins. So, there is a theory that says endorphins are released when you crack your joints, and that leads to a satisfactory or a happier feeling. However, I'm not sure how true that theory is, so don't take my word for it. It's just something that I came across, but I'm not sure how valid or true it is. So that's one theory behind it. Now, this is the pros. Now, let's look at the cons. So, it neck cracking. Basically, okay, another thing that happens when you crack your neck, before I go into the cons of it, When you are stretching your joint to that extreme range, there is something called the ligaments. You must have heard about ligaments, especially knee, ankle ligaments. So around every joint there are ligaments. Now these ligaments are like elastic rubber bands, right? So they have a certain amount of elasticity, so they get stretched. Now what happens to a rubber band when you repeatedly stretch it? It sort of loses its elasticity, right? Depending on how much you're stretching it and how frequently you're doing it. The same thing happens with our ligaments. They get stretched beyond their normal limit every single time you crack your neck. Now, it when these ligaments are stretched out, your joints tend to be more mobile, known as hypermobile joints or hypermobility. So, when your joints are hypermobile, they are more prone to problems like osteoarthritis, etc. So, this is one thing in the long run. If you keep cracking your neck, you are more prone to arthritis. It's not going to develop overnight, but we are talking years and years of cracking your neck, because this is a habit that's hard to break. All right. The other thing that happens is, especially in the neck, there are a lot of blood vessels and important structures in your neck. So if you look at the blood vessels, there is if you there are like blood vessels going up, coming from your heart, and obviously going through the whole, wherever they go, and then after that they're coming up into your neck in up your neck area, and it goes and supplies your brain. So one of the main arteries on either side of the neck, if it gets pinched, you can imagine there is pause to the blood supply to the brain. Of course, not a good idea. It can lead to fainting. And if there is, say, a kink in the artery, it can even lead to clots, and then the clot travels to the brain. Obviously, again, not a good idea. So, if you've been repeatedly over a period of time being one of those people who crack their necks every day on a regular basis throughout the day, keep this in mind. It's not a good idea, especially if you're one of those who are not qualified. I mean, I'm not saying you're qualified, you can crack your neck, but if you do it the wrong way, there are a lot of repercussions that can happen. Another thing, which is more common, is you have these nerves that exit your cervical spine on either side. Between every two vertebrae, there are facet joints, as I mentioned, and at the facet joint level, there are nerves that are exiting the cervical spine, like the rest of your spine. So in the neck, let's consider the neck. So this is your upper to mid cervical spine, so the upper to middle part of the neck. The nerves that exit in that area go and supply the back of the head and around the sides here. If those nerves are irritated, it can lead to headaches known as cervicogenic or cervical headaches. It can lead to cervicogenic or cervical dizziness, or cervical vertigo, as it is called. Obviously, I'm not going to go into the details of these topics. However, if you want to know more about these, you can go to my YouTube channel. I have recently done a couple of videos on these topics, and if you can't find them, just go to YouTube, type my name, Swati Prakash, headache or dizziness, and it will come up. If you can't find it, just message me and I'll send you a link. Another thing that happens is, if the nerves in your middle to lower cervical spine, these are irritated or compressed, you can get nerve pain, that is burning, tingling, numbness, discomfort, or just a pulling pain anywhere along your shoulders, arms, forearms, up to your fingertips as well. Depending on which nerve is irritated or compressed, that is the area that will feel the nerve pain. So there are a lot of negative, I would say, side effects of cracking your neck. So to be honest, it's not a I mean, it's a habit that's neither good or bad, but there are a lot of repercussions that can happen. And if you've ever had nerve pain, that's not something you want to experience. So, if it is a harmless cracking, there is no pain, no discomfort associated with that. It's your choice whether you want to carry on. However, if you have pain or discomfort in your neck, or you feel that nerve pain or sharp shooting pain down into your hands, dizziness, headaches, at the same thing that I just mentioned, it is better you go and see your healthcare professional, your doctor, chiro, or physical therapist, and have it sorted out. Now, if you're not sure why you have neck pain, or if you have neck pain and you want to manage it and are not sure how to manage, the very first thing is, if you have neck pain, whether it is because of a disc herniation, stenosis, nerve pain, because of which you have nerve pain, all these conditions have one basic problem, that's issue that is going on with the body and in the neck, sorry, and that is inflammation. So if you want to learn how to manage your inflammation, I will leave a link in the blog that I have written on the same topic. I will leave a link to the blog in the description of this video. If you're on Instagram, you can find the blog in my bio. If you can't find it, just message me and I'll send it across to you. So in that blog, I have given a free guide on what can be the potential causes of your neck pain. I have left a link to a free program that can help you to manage your inflammation. It's all natural. It's all very legit. I have been doing it for the past year and a year plus, and there are many people who have seen good results. So have a look at the blog. It will have some more information on there and links to psychogenic dizziness, headaches, etc. Alrighty, if you have any questions, any comments on today's video, do let me know and I'll be happy to help you out. I'll see you guys